This slide shows the contents of my presentation. As you can see, there are 4 parts. First, I'll show worldwide utilization of peritoneal dialysis. Second, I'll talk about the utilization of peritoneal dialysis in hospital. Third, I'll talk about the key phrases to increase utilization of peritoneal dialysis. And finally, I'll finish with a brief conclusion. Now, I'd like to start with part 1. Let me start with the slide which shows the change of the number of patients with end-stage kidney disease or ESKD in various areas in the world. The number of ESKD patients is increasing in United States of America or US, European area, and Japan. However, such increase is more obvious in other countries, including your country, Egypt. So, what kind of modality is utilized as a renal replacement therapy in the world? This slide shows the utilization status of 3 kinds of modality: hemodialysis or HD, peritoneal dialysis or PD, and kidney transplantation or KTX in the world. As you can see, the number of ESKD patients is increasing 5 to 6% yearly, and the number of patients treated with PD is also increasing 6% yearly. Such situation means that PD is commonly utilized as a standard modality to treat ESKD patients worldwide. This slide shows the status of the proportion between HD versus PD as a treatment modality for ESKD in top 15 countries, including Egypt. The number of ESKD patients is the largest in China, which is followed by US. You can find Japan in the 3rd line and Egypt in the 12th line. As you can see, the proportion of PD is obviously low both in Japan and in Egypt. Although the reason why PD is underutilized in Egypt and Japan is unclear, from the viewpoint of international comparison, PD could be more utilized in Egypt and in Japan. Next, I'd like to talk about the PD utilization in a hospital. Now, I am working in Japan, Chiba Prefecture. Chiba Prefecture has Narita International Airport, the largest international airport in Japan. Our hospital, Teikyo University Chiba Medical Center, is one and only university hospital in Kazusa and Minamiboso area of Chiba Prefecture, which area has over 1 million residents. I had arrived at the present post, the professor of nephrology department of Teikyo University Chiba Medical Center, in May 2017. At that time, the number of ESKD patients treated with PD is 0 in a hospital. Not only in a hospital, but also in other neighbor hospitals, PD treatment was not performed at all. While after my arrival at the present post, the initiation of PD has started and the number of PD patients is increasing year by year, as you can see in the lowest line of the table. This slide shows my past career regarding the utilization of peritoneal dialysis. As you can see, I have succeeded to increase the number of PD clients in each hospital which I belonged to with the help from my colleagues. To utilize PD more widely, especially on elderly patients with marked disability, we have begun full assisted PD. Full assisted PD is a phrase coined by myself. Assisted PD is defined as PD treatment performed at the patient's home or in a nursing home and based on assistance from a healthcare technician, a community nurse, a family member, or a partner. And I'd like to define full assisted PD as assisted PD with annual once or twice a month visit of attending doctor and daily visit of home care nurse to patient's own home. This approach relieves patient family from carrying heavy weight of assisting PD procedure, relieves patients with disabilities, which are caused by aging and comorbid status, from visiting hospital annually. In some patients treated by full assisted PD, their activity in daily life had improved markedly after initiation of this modality, partly because this modality enables home visit of physical therapist, and perhaps partly because the induction of this modality decreases conflict between patient as care recipient and their family member as caregiver. Next, I'd like to move on to part 3, two key phrases. Why the number of PD patients in a hospital increased. In other words, how I increased utilization of PD treatment in a hospital. I will show two key phrases which I always keep in mind to increase PD utilization. There are two key phrases. The first is see one, do one, teach one, and the second is think locally, act regionally, leverage globally. I'd like to start with the first phrase, see one, do one, teach one. This phrase has been frequently used by mentors when I was junior resident doctor of St. Luke's Hospital standing on the Sumidagawa River, Tokyo, Japan. From my understanding, see one, do one, teach one means that to master something completely, seeing it is the first step, doing it by yourself is the second step, and teaching it as a mentor to your young follower is the final step. And, of course, it is also the case to master PD treatment thoroughly. If you can become, so to speak, PD master, then you can reach the halfway to the goal to increase utilization of PD in your hospital. So, what does the seeing means? There are examples of the seeing. You may visit and observe the practice of leading hospital regarding PD management. In addition, working at such leading hospital regarding PD management as a medical staff is also fruitful. And to take part to catheter insertion as an assistant of operation helps you to understand the procedure of PD catheter insertion precisely. By the way, to note, yellow arrow in each picture shows the speaker myself. This slide shows specific examples of the doing to make you PD master. At first, it's better to take part in leading hospital as a doctor in charge of patients treated with PD. Next, training surgical skill using simulator of PD catheter insertion procedure makes you familiar to this procedure. After full preparation through such experiences, you will be able to participate to catheter insertion procedure as a main operator. Teaching PD management and PD catheter insertion as a mentor to your young follower is the final step to make you PD master. To teach medical students theoretical background of PD therapy, to teach trainees PD treatment including management, operation, troubleshooting, and to steer beginner surgeon as an instructor. All these experiences make you PD master who can begin PD therapy wherever you are working. You may ask that, does internist measuring nephrology need to insert PD tube like surgical doctor? To your question, my answer is nephrologist not needs to insert PD tube, but nephrologist as PD master should better to do so as a main operator. This figure, which is referred from our past paper, showed the differences of nephrologist involvement levels between high volume center and low volume center in Japan. In this study, high volume center means that the number of PD catheter insertion is higher than 5 per year. As you can see, the ratio of nephrologist involvement is statistically higher in high volume center than in low volume center. Such fact might mean that undergoing PD tube insertion by nephrologist is the shorter way to utilize PD widely. Now, let me move on to the second key phrase, think locally, act regionally, leverage globally. Although I don't know the source of this phrase for certain, this phrase is commonly used in business scene. The spirit behind these words, I think, is also important to make PD common choice among three kinds of renal replacement therapy. At first, let's think about thinking locally. Regarding PD therapy, in my opinion, it is equivalent to assessment of the needs for PD therapy in your own community or region, and to making strategy regarding how to use systems around you in your hospital and in your community to start and expand PD therapy in your area. Right approach to right place will offer you encouragement to smart of PD in your hospital. Second, let's think about regional action. The regional action in this context means teaching PD to your colleagues and appealing the usefulness of PD to the residents of your community. To increase the number of supporters and followers, make you easy to progress PD utilization in the hospital. As to me, I had appealed benefits and realities of PD through lectures at inside and outside of hospital, as you can see in these pictures. In addition to regional action, I believe that you'd better leverage globally to keep your action justifying. To leverage globally, you may attend medical conferences and medical societies, both domestic and international, to communicate with other PD masters in other regions or countries. Reading and writing academic paper is also a good way to leverage globally. The most important is updating your PD manner constantly. Now, I would like to finish by making the following conclusion. To increase PD clients in your hospital or clinic, at first become PD master and then act around. That's all I have to say. Thank you for your attention.